Special session. We have two speakers from the HTSA Consumer Engagement Action Group. So this project was a special project by the HTSA Consumer Engagement Action Group on consumer co-authorship, and it's more about, as we all saw today, in terms of affiliating consumers, what are the best practices around there, so that's how this project originated, and we have two speakers, Dr. Elizabeth Lynch and Dr. Nadia Corsini, who both are from the HTSA Consumer Engagement Action Group, and they will talk about the co-authorship survey. Dr. Elizabeth Lynch is a senior research fellow at the College of Nursing and Health Sciences at Flinders University. She is dedicated to improving how stroke rehabilitation is provided. This research involves working with healthcare teams and people living with stroke to develop and test systems so that every person who has experienced a stroke receives rehabilitation interventions that have been proven to reduce disability and optimize function. Dr. Nadia Corsini is currently Senior Research Fellow at the Rosemary Bryan Research Center. She is a behavioral scientist with expertise in health research and evaluation, having worked with industry, government, and consumer partners to inform the development of resources, services, and policy to improve health outcomes. So please join me in welcoming Nadia and Liz. Thank you.
Thank you. We'll probably finish up quickly with this one. Thanks everyone for sticking around for the end of the day and for just hearing about this project that we're thinking about and planning, but we're also just seeking feedback as whether or not there's any validity in us putting some time into it. So if you've got feedback, good or bad, we're very interested to hear. So what is this authorship stuff all about? So if you're working in co-design and co-production, what are we doing with our authorship? So I think when we're doing research, there is growing recognition that we need to involve different stakeholders in research. So traditionally, you've got the people working in universities and people working in labs, and if they can talk to each other, that's really helpful. But we're moving beyond that now so that we're actually getting the academics to work with the health professionals, which is a good step, but beyond that, and what we're talking about now is actually talking to the people in the community, the people that are receiving the healthcare. And if we can get all those people working together, then the idea being that we can have really impactful, really meaningful research. So we are seeing more and more people who have got lived experience being co-researchers. So you've heard this all day. So it's people who are members of the research team, not just research participants. So that where they're being invited to join a research team because of their lived experience, they will have other attributes and skills often as well that you'll be asking them to bring to the table and share. Having these people help guide the research, attend the research meetings, helping to analyse results and contributing to the research outputs. So when we're getting people with lived experience doing all these sorts of activities, then they should be named authors. And that there's really clear guidelines on who gets authorship and who doesn't. And so we're now talking about when we've got these people on a research team and they're there for their role of their lived experience and they're there as a co-researcher, how are we acknowledging them? So part of promoting working with people with lived experience is to normalise this process. Certainly in the field that I work in, it's quite new to be working with people with lived experience as a co-researcher. And so we've got some people who are doing it who are guiding other people, but if we can promote that work, make it really obvious, make it kind of standard practice, then we can have build the momentum. But if we can't see the contributions really overtly, this is kind of our concern might be that if you can't see it, you don't want to be it. So if we're talking about some of the research projects, you will sometimes, so these ones that I'm putting up, these are research papers that have been done with researchers, clinicians, and people with lived experience of the health condition. So that you'll sometimes have people who are representing a community reference group. So that's really clear that you've got people living with the condition who are contributing to that research output. And this is one that I was involved with personally. So we had researchers, clinicians and people with lived experience But their research affiliation is that they've been, it's kind of hidden because they're being given honorary affiliations with the university. And so this is someone who doesn't have a PhD. She is a paid researcher, but to look at this paper, you would have no idea that there was someone with lived experience contributing to this output. So I think...
And so this is a very different situation to academic authors, where we have a very specific set of instructions that guide how our authorship, how we are affiliated on academic papers. So there are very specific guidelines around how your institution is mentioned, your research centre. There's even we each have a unique identifier, a series of letters and numbers, so that there's no possible way that you could ever be mistaken for, say, another Nadia Corsini who might be a researcher in another part of the world. So this is how important it is. For academic authors, our reputation depends on, to a large extent on, what we're publishing and where and how much. And universities gather information from these papers about us and put together a number of statistics about, how much you're publishing and where, and make judgments about your impact. So it's a very different set of circumstances for academic authors to non-academic authors, where there's no sort of tradition or set of guidelines or principles guiding how affiliations are constructed. And what we're questioning is, well, what is important to know, and why is that important? Do we need some consistency for affiliations in regards to non-academic authors? It's certainly a very different scenario, but is there value in having a consistent approach? And if so, what details are important to to have that consistency on? And then can we come to a consensus on these things? Will preferences vary? Will everyone want to be identified as contributing their lived experience to a project or not? And is that important to consider? And ultimately, we are posing the question, should we find out, should we do some work to find the answers to these questions? We have done some initial scoping work with some health promotion students from UniSA who have looked at the literature to see whether anyone else has asked this question, and what is known or what has been done previously. And we know that there isn't a lot out there to guide this particular question. And we have also had some students doing some thinking around, if we were to look at this, what questions should we ask of consumers, as well as other groups, such as people that are involved in the publication of academic outputs, like journal publishers and editors, as well as trying to understand the kind of attitudes and views of researchers. And so what we would like to pose to this group is, are we on the right track with this? Is this something that you think is important to pursue? Are we asking the right questions? And we'd be really keen to get your feedback. So to gauge that, I know we've just presented this very quickly to you, and you may not have had a chance to fully digest it, but just, to get a sense of what the feeling is in the room. And we've really, Liz and I and the team will not be offended by either positive or, or sort of, negative or critique about how we're going about this. We'd really like perhaps a show of hands, who thinks, that perhaps this is we're not on the right track in the scheme of things. This is not an important issue to pursue. So we'd very, very brave to put your hand up here, I know, but we really would like to know if anyone thinks, not so sure you've got this right. Okay. And I don't want to assume that everyone else is on the positive, but I will ask for a show of hands of who thinks these questions are worth answering, and this is a project worth our group pursuing. Oh, excellent. And who's on the fence? Would like to know more. And would you like to give us some feedback? Is that a
So who does it benefit? What's the value?
Yes.
What's the value?
I think it's really interesting to explore. I guess I've got more questions than I have a stance.
That's a really good question. Did you want to talk to that?
I think it's really important for us to be really cognizant of, like, who is this, because I'm coming at it from a researcher perspective, and I was trying to gauge how well are we doing in this space, and I can't tell because I'm looking at these papers like, I don't know. And so from my perspective, from a researcher, I want to be able to see how much co-design work are we doing. I'm projecting and thinking people with lived experience. I know I work in the field of stroke. Some people are happy to share that they've had a stroke. Some people prefer to disclose it as they see fit, and sometimes keep it private. And certainly there are sometimes people bring their lived experience when they don't want to share it openly. So from my perspective, I'd be interested. I have no idea what most people with lived experience want to say. Yes, I'm here and I'm contributing in my lived experience and I want to be seen as an expert and honoured for that. And other people might be saying, I'm here as a team member, I don't care how I'm acknowledged, and that I think is important it's not important, it's interesting to know, but is it important to know? And that might be one of those things that's an academic question and I don't care, go away, don't waste my time. So that is something we just are interested in finding out.
So I think a lot of us are probably like, yes, there is merit in asking these questions. I'm not sure that the way that you're asking the questions is necessarily, I think it's one of those things that you can't capture all perspectives in one. So I think it really does depend on a case-by-case basis. I was surprised when you said there's not much out there, because I would say there is quite a lot out there already. Although maybe the search terms you were using didn't capture a lot of the stuff that's out there. I know that there's a lot, well, there's enough about Indigenous-led research and co-authorship that it should be drawn on and should kind of be the basis for this, I would say, particularly since we're working on Kaurna country or First Nations country in Australia. So there's some assumptions, I think, embedded, and you're aware that there's assumptions embedded. I think you're right that you're embedding assumptions that would be worth unpacking, but it is a good thing to do as researchers to unpack some of these assumptions about why we value co-authorship and what it means to be a contributor and things like that.
Yes, thanks very much for that perspective. Yeah, that's really important. And the Indigenous literature is something that we can go back and have a look at. Thank you.
So we do have a question, or actually Lana Earl, who's actually online, is now unmuted. Lana, would you like to ask your question?
Yes, I would, but I don't know if you can see me because I can't really see me, but can you hear me?
We can hear you.
But I can't see you, but that's okay.
Yeah, I'm not sure why.
That's all right. No, you go right ahead and ask your question.
Thank you. I'm glad this has come up because I think we have to pay respect to the people that's contributing to your research. And I often have seen an acknowledgement, but if they're actually actively contributing to the write-up, as in co-designing the questionnaires and the co-design the environment, the surveys or whatever, I think it's very important to ask, do you want to be named However, I have a feeling because there's the rules and the regulations around the authorship for an academic is very high. Perhaps we have to maybe think about, should we write perhaps how a consumer co-author would look like, and should we put that forward to the authority or whoever governs this, that their criteria of being maybe an associate co-author should look like this. So it is governed very well and come across very well and clear, especially for those student research fellows. Thank you.
Thanks, Lana. Yes, there are a number of sort of issues and topics around being an authorship and contributing to, you know, being a co-author on a particular output. I suppose what this project is looking at kind of more acutely is, once that has already been established, this person is an author on a particular output, should there be some consistency in how their, you know, name, where they're from and who they are is written in as part of the affiliation. So with academic authors, there's absolute consistency, and we can generate a bunch of statistics about who does what and when and how often. With consumer authors, we absolutely can't do that. As Liz said, often we don't even know. It may be hidden entirely that person is an author that has contributed on that piece as someone with lived experience. There's no way at present, there's no way of knowing that. So is that something, are we happy with that situation or not? If not, what is the solution? And is it important to establish some sort of consistency about how that is done, and would that be helpful to the community? I guess that's the question that we're grappling with and would like to, you know, I guess explore a little further. Yeah, does that cover it? There's a lady. Oh, sorry.
Oh, sorry. There's a question here, and then I can go there. Hi. Yeah, thank you for clarifying that. I think knowing that a consumer can be listed as a co-author or will be, and it's just that acknowledgement of their consumer role that we're discussing. I really like the question about who does that benefit, and maybe that's something to explore from researchers and consumers as well, to see if it's of benefit to consumers. But then just thinking about that, is it the authorship space that it needs to be acknowledged, or is there something, you know, towards the end of journal articles that have an acknowledgement section? And is there something about consumer engagement that can be a standard kind of thing that people outline how consumers were engaged throughout the process, or which consumers contributed? So just another thought.
Yeah, they're really important. Thanks.
Hello. I've just got a comment to say, is I think the question about who it's for is really important, but I think the other side of it, and to this just my thoughts, is that we build a system where consumer and community voice is essential in everything that we do it, so that we actually have a system that's set up and people can either opt in or opt out, whether they want it. But we've actually thought about it from the research point of view, is that we actually have authors and there's all the academic jump through, but also as people are going for grants, is a push to make sure you have and you are transparent about your consumer voice being there, so that therefore we have a process that actually acknowledges them. It's a little bit like you can get reimbursed, everyone's entitled to reimbursement, whether you choose to apply for it or not, up to you, which is important, I think, for our consumers or anyone. But I think it's important that we set up a system where we're actually really transparent about the consumer voice is there, and that we have a process in which we can measure it and validate it. And certainly, like the previous speaker, is at the end, is it can be at the end to say this is how, you know, consumer and community engagement. But if the point of it is about a system change and about really being transparent about what we hear and consumer voice is important, then we need to set up a system to do that, and that it's acknowledged.
Great points, thank you. And so the only other thing, because I think in most full academic articles, which are often behind paywalls, so that you might not be able to get it if you're not in a university, that you will be able to find if you read the whole article. And so that is good. That's good. Is it enough, or do we want to be able to see that anybody who's looking on the internet and sees the abstract, and you can see where everybody was working, then it's really obvious. Maybe it's not important, but maybe it is. But that is I guess we're getting a feel here that there is interest in this, but we do need to be mindful of to who, yeah, who cares, you know.
There are some things just to unpack. So anyone can get an ORCID. You don't have to be affiliated with a research organisation. So in terms of some of the barriers that I think you perceive, I think that they don't exist. And I think for a lot of us that are early career researchers or that have shifted from different areas into research, for example, you can actually have continuity between roles, right? So there's nothing to stop consumers from having an ORCID, and then potentially, you know, as people shift through, they might eventually do a PhD and become, you know, a lived experience advocate. So I feel like that already all exists. So I think it's worth maybe going back to some of those first principles and going, actually, maybe there are some journals that are very strict about those things, and maybe we need to push back on that to say, no, it doesn't fit. But I do feel like you're trying to kind of make things a lot more black and white than they actually already are, and that there is already a lot of work in this space, particularly kind of decolonizing health and in development studies and that kind of thing. So yeah, there's some things like that to break down and unpack, but yeah, I think it is a good thing to explore.
Thank you.
Hi, Thomas here from Flinders Uni. I do a bit of research with assistive technology in stroke, and I wanted to mention I was at a conference last week where they were talking about a certificate in assistive technology mentoring. So this is where people that have lived experience of disability that are assistive technology users get a formal qualification for their work so that they can become recognised as a way of formalising an employment pathway. And I think this is a good opportunity to then give somebody a research track record, not so that they can become a researcher, but just as a way to recognise this is a person with valuable experience that can contribute to research and then broader society in a meaningful way. So I think, yeah, really good idea.
Thank you. Thank you.
Any other questions online? All good? Anything else from here? No?
Thank you very much for all your questions. It's been really, really helpful for us as we will keep going, but it will help us to shape what we're doing moving forward. So thanks, everyone.
Thanks, Nadia. Thanks, Liz.